Next, let us discuss about the common issues with the needles. First is pain on insertion. So, why? What is the cause? This can be due to the dull needle, which happens after the repeated penetrations. To minimize the discomfort, always apply topical anesthesia before needle insertion and stretch the tissue slightly. Second issue is needle breakage. Although breakage is rare, it is more common with the smaller gauge needles like 30 gauge. Always avoid bending or also avoid forcing it into the hard tissue like bone in order to reduce the risk of the breakage. Next is needle withdrawal issues. Needles can develop a barb when they contact the bone. So if the needle hits the hard tissue like bone, then there is a chance for developing a barb at the tip. So this can cause pain when withdrawing the needle. So this can cause pain while withdrawal. This barb is known as fish hook barb. If you suspect a barb, it's best to replace the needle before further use. What are the techniques for minimizing needle complications? First is avoiding breakage. How do you avoid breakage? Do not fully insert the needle to the hub. The area near the hub is the weakest part of the needle and most susceptible to the breakage. So near the hub, it is the weakest portion and more susceptible to breakage. Only insert the needle fully when absolutely necessary for the procedure. Repositioning. Never change the direction of the needle when it is embedded in the tissue. Always withdraw the needle first, almost fully, before making any adjustments. Never change the needle direction when it is still in the tissue. Withdraw the needle fully and then do the adjustments. Third is minimizing patient and administrator injuries. So how can you minimize them? By maintaining attention. Be aware of both your positioning and patient's movements. Keep the needle capped when it is not in use and recap it immediately after withdrawal from the patient's mouth to avoid the injury. In dentistry, there are a few standard techniques used to handle and save the needle safely after injection to avoid injury to the patient or dental professional. These techniques are designed to minimize the risk of accidental needle stick injuries. Here are some primary techniques. First one is one-handed scoop technique. This is one of the most recommended techniques to recap the needle safely after it is used. Clinician uses the needle to scoop the cap back onto with one hand without touching the cap with their other hand. Once the cap is partially on, then clinician can use other hand to fully secure the cap. This method minimizes the risk of accidental sticking oneself since it does not require holding the cap with your hand. There are some other devices which are known as needle recapping devices, which include needle cap holders, syringe holders. Avoid hand-to-hand passing. Needle. There are some needle clipping devices. And immediately dispose the needle into the sharps. By this, we have completed our discussion on the dental needles.